and I did a literature review on a paper by Kwan and many other authors that was published in 2021, which examined the relationship between pulse arrival time, sleep apnea, and cardiovascular diseases. So a little bit about this study. It was published in 2020, as I previously said, by Thorax, which is an international journal on respiratory medicine. There were 14 total authors, which represented 8 different medical and engineering schools, and they were led by Dr. Kwan, who is a researcher and doctor at the University of Washington School of Medicine. So looking at the literature that supported this work, so there were many different ideas that were used as a basis for this study, but there were 40 works cited in this article that supported it. So the supporting literature is pretty numerous. The most important idea is that cardiovascular disease is linked to obstructive respiratory events, which is the entire basis of this work, and allows the authors to correlate that to pulse arrival time. And it was supported by Circulation and the New England Journal of Medicine. So there are many high impact journals that support this work, and overall it is a very well cited and very well supported work. So looking at a little bit of the background which led to the hypothesis, purpose, and significance. So the team hypothesized that the change in pulse arrival time due to obstructive respiratory events may serve as a reliable indicator of increased cardiovascular risk factors, specifically in individuals with obstructive sleep apnea, and more specifically, that change in pulse arrival time is actually a decrease. And if you don't know what obstructive sleep apnea is, a diagram of it can be seen on the right, where the soft palate in the throat collapses back on the airway, which prevents air from flowing during sleep. So the purpose of this study was to determine if pulse arrival time could be used in sleep studies and have any clinical applications to predict worsening cardiovascular health. The significance of the work is that it could improve risk stratifications in patients with sleep apnea, so basically defining how much at risk patients with sleep apnea are for cardiovascular diseases, and it could also suggest a clinical use of pulse arrival time in connection with subclinical and future cardiovascular diseases. So this was a very large study. There were over 1,400 participants with an average age of over 68 and an almost 1-to-1 male to female ratio. In terms of the inclusion and exclusion criteria, so participants were chosen from MESA sleep study, which began in the year 2000. Participants at the time of recruitment did not have any cardiovascular diseases, and participants were excluded if their pulse arrival time assessment was not adequate, because that's the entire basis of this study. This sample is very representative of the general population in terms of percent breakdown by age and sex, but it is not, or not by age, but by sex and race, but it is not representative of those of age, but importantly, it is representative of those who have sleep apnea and are at risk for cardiovascular diseases, which is more males than females and of older age. There was a slight selection bias, slight bias towards male, but nothing too significant, and a significant age bias due to higher risk factors as humans age, which is what's being tested. So the methods and design, this was a 3-leveled study where all participants gave consent, and the protocols were approved by each institution's review board, so that is all 8 institutions, and the subject's rights were protected. So the first part of this is that there was a sleep study, an overnight sleep study that evaluated the presence of sleep apnea in each patient, and that was done by measuring the percent airflow reduction during an obstructive respiratory event as compared to the pre-event baseline. And then also during that sleep study, the researchers measured ECG and PPG signals, and that data was filtered using MATLAB to find pulse arrival time decrease during obstructive respiratory events. And an example of this data can be seen on the right, where at the top you have airflow decrease and also pulse arrival time decrease. An increase on that chart is a decrease, as can be seen on the y-axis. And then they also assessed cardiovascular diseases. So an outside medical team, which was blind to the sleep results, assessed each patient for the presence of cardiovascular disease, including many different types of cardiovascular diseases, but this followed a pre-specified criteria. And in my opinion, the study design was appropriate and adequate for testing the research team's hypothesis. It was a very complex study, and there was obviously a lot of thought, a lot of disciplines that went into this, a lot of data, and the methods certainly show that. So looking at the analysis, first thing they did was apnea scoring. So they determined that someone had sleep apnea and had an obstructive respiratory event if there was a greater than 90% airflow reduction compared to the pre-event baseline for at least 10 seconds. So airflow dropped by 90% individual while they were sleeping for at least 10 seconds. And then they also determined that there was a significant pulse arrival time decline if that pulse arrival time decline was more than 2 standard deviations from the baseline and within 3 seconds, and if it was within 3 seconds of an obstructive respiratory event, they were correlated. And because pulse arrival time decline curves may be skewed, median values were derived and aggregated to more accurately represent each subject due to just many confounding variables that could have popped up. Cardiovascular disease markers. All scans for cardiovascular disease, as I previously said, followed a pre-specified criteria from a blind medical review board. And looking at the statistical analysis, the most important thing here is what I'll show you on the next slide as well, is that the relationship between pulse arrival time and obstructive events, as well as the relationship between pulse arrival time and cardiovascular risks and diseases were related with Pearson coefficients, so an R value. And they also used a P value to determine its significance. And confounding variables such as smoking, age, sex, and race were adjusted for in each model. They didn't go into too much detail on this, but we do have to assume that they did a good job in adjusting for these variables. And I believe that the statistical analysis performed was adequate for the study and well adjusted to prevent bias on the results and provide overall significant results. So looking at the results, this is a very large slide, but I will try to condense it as much as possible. So basically they found that it's plausible that pulse arrival time could be a physiological predictor of cardiovascular diseases, especially in patients who have obstructive sleep apnea. These results are consistent across 3 different cardiovascular diseases, including measurement of left ventricular mass, carotid plaque burden, and coronary artery calcium. And the results, as you can see on the bottom right, are all statistically significant, but there is a difference between statistical significance and clinical significance, which needs more work to be determined. In terms of presentation, there was a lot of data, a lot of raw data, a lot of filtered data, and it's presented in a fairly clear manner given the amount of data that was shared. The authors also used statistical reasoning to interpret the results, but did note that there was a difference between statistical and clinical significance, as I previously said. This study is strong in the fact that there's a small selection bias with a very large representative sample, and they used up-to-date clinical techniques for data collection. But it is limited in the fact that there's a relatively small number of cardiovascular disease outcomes that were studied. The authors actually mentioned this, and there's also just inherent challenges in minimizing all confounding variables, and there are many confounding variables to cardiovascular disease. So looking at the significance of this work in terms of its implications and the body of knowledge that it contributes to, this work certainly provides a basis for which pulse arrival time could serve as a novel physiological marker and predictor of cardiovascular disease risk, and more specifically in patients with obstructive sleep apnea. This work also contributes to the fact that shows that there's increases in accuracy of risk stratification. So basically this work allows clinicians to go in and say you're at a higher risk because of your pulse arrival time decreases when you sleep. And then this work also may lead to more work on preventative health measurements for cardiovascular disease. In terms of replicating the study, it's a very large and complex study where the results could be replicated, but not necessarily easily, and would likely require a very large team, as was in this study. The most important result most important question that this study brings up was how this data translates to clinical and qualifiable health outcomes. So that means not just statistical, but how that actually translates to a patient and what they feel. So that is all for me. Thank you so much.